Hello, everyone. Good evening. Thank you all so much for joining in for today's session. So, as all of you know, today's session is on how diabetes affects women's health, right? So, we'll talk all about PCOS and how that impacts diabetes, how your menstrual cycle impacts, diabetes, and all of those things. So, today we have with us, Coach Bhakti from Sugarfit. So, thank you so much, Bhakti, for taking the time out of your day and being here. We just want to give you a very warm welcome to the session and hope the session goes well and all of you get to learn a lot of things today. So Bhakti is a coach here at Sugarfit, like I said, and she has a lot of users who have reversed diabetes or in the process of reversal. So if you have any questions that you want to ask or any doubts you have, as we go along the presentation, if you have any doubts, go ahead, leave all your comments and questions in the comment section, and we'll answer all your questions toward the end of the session. But over to you, Bhakti. You can go ahead and get started.
Thank you so much, Rifa, for the introduction. Firstly, I would like to welcome everybody who is on board here to show interest in the talk. I'm sure some of the other people, either you know or you yourself, are faced with such issues, and hence you're like here for the solution. So I think let's just waste any time and not waste any time and start with the session. So as you know, today we are going to talk about understanding diabetes and its impact on women's health. Most of us might be knowing that there are a lot of hormonal issues that women face, be it with diabetes, without diabetes. But imagine the kind of hormonal issues and related issues that a woman would face if she has diabetes, which is also a hormone related issue, and PCOS or any other hormonal issues related to women's health. Um, Firstly, how does diabetes impact women's health different compared to men? Okay, so here what we see is, firstly we see all the hormonal changes. Almost all the women must have heard, whenever they see any kind of mood swings, whenever an opposite person sees any mood swings, they would say, "Are you going on any hormonal changes?" Yes, sometimes that does happen. Women's hormones fluctuate throughout, especially during the pregnancy, during the menopause, even every month when they are about to get their menses. Right? They are also at a high risk of heart disease. Women with diabetes are generally at a higher risk of heart disease than men. This is not there normally. The risk comparatively is very lesser if women has only diabetes and not any hormonal, any other issues, or even plain diabetes but uncontrolled diabetes. Secondly, they also face this issue of depression and eating disorders. Nowadays we see a lot of things and a lot of emotions which are linked to your eating. If you're sad, you would just reach out to food. If you're happy, you would just celebrate with food. If you're facing any stress, you would just go out and reach out to food. So all of these together clubbed can cause eating disorders. Now, because of all the other hormonal changes going on in a woman's body, they do face depression, and because of which ultimately leads to eating disorders. So all of this are, interlinked with each other. So other thing, how does menstrual cycle, impact your blood sugar levels, impact a female's blood sugar levels? We all know that our menstrual cycle, our day-to-day activity, everything is all, linked to some or the other kind of hormone in our body. Two major hormone in female body is estrogen and the other one is progesterone. Now, a menstrual cycle completely involves fluctuation in these hormones. Like I said, primarily in estrogen and progesterone, which also affects your insulin sensitivity and glucose metabolism. To put it in simple words, if the fluctuations in estrogen and progesterone are high, your insulin sensitivity of the body reduces. If your body's insulin sensitivity is reduced, the sugar levels go high. Now, reduction in insulin sensitivity, which means that your body's cells, do not use the released insulin in the correct manner or in the right amount to digest your food, of course. So ultimately, if the insulin sensitivity is reduced, your glucose metabolism is going to be affected. So simple word, simple sugar metabolism and your food metabolism will be affected. Okay, now we have these phases in menstrual cycle. The menstrual cycle is the first and the fifth day, normal first to fifth day of their menstrual cycle, where women with diabetes may experience more stable blood sugar levels as the hormone levels are relatively very low. This is the time where where you don't even see a lot of mood fluctuation. Follicular phase, which is 6th day till 14th day, here the estrogen level rises. Potentially, your insulin sensitivity also increases. Okay. In this phase, some women may require lesser insulin because the insulin sensitivity is increased. The usage of insulin is, happening in the correct way or is happening more. That is why the quantity of insulin required will be comparatively lesser. Uh, just to put a note here, this is for some women. It may not, apply to all the women with diabetes. The other one is ovulation phase on the 14th day. Now we know ovulation phase is the egg release day from the ovaries to in your fallopian tube and your uterus. Now this ovulation phase leads to sudden increase in your hormone, okay, including your LH, which is luteinizing hormone, and your FSH, which is follicular stimulating hormone. Okay, this can cause a brief spike in your blood sugar levels for some women because, like I said, if these hormones are up along with your estrogen and progesterone, it is going to reduce your body's insulin sensitivity. So all of these are linked together. Okay, then is your luteal phase, which is from day 15 till day 28. Normally, a cycle is 28 to 30 days, depending on women to women. So this can be from 15 to 28 day, 15 to 30th day, depending on what is your cycle. Here, your progesterone level increases, and this can lead to insulin resistance. Insulin resistance is the opposite of insulin sensitivity, which means that your body is releasing insulin, but it is not utilizing in the right way, which means you will considerably see an increase in your sugar levels. Now, these are the days when most of the people around you might see mood swings. You might get cranky. You might just want to binge eat on something. But this is the phase where you actually have to take care about what you do, what you eat, how much you eat. Right. Now, what can you do for all of this? There are four simple steps. Okay, out of this, when it comes to two comes under your exercise or your meditation. For example, the first thing is maintaining a well balanced diet, which is rich in fiber, whole foods, controlling your carbohydrate, and stabilizing your blood glucose level. So make sure your meal plate is very well balanced with approximately say, around 50% of fiber intake in the form of your vegetables, in the form of your soups, in the form of your salads, and also in the form of sprouts. Other part, make sure that your meal plate has approximately 30% of protein. If you're a non-vegetarian, of course, you can have your eggs, you can have chicken, you can have fish. If you're a vegetarian, maybe go ahead with having paneer, you can have sprouts, your pulses, your tofu. These are also very good for source of protein. The other 20% has to be your source of carbohydrate. Now make sure that you're not overdoing on carbohydrate. If you feel that you're not full with this much what you had in your plate, help yourself with an extra serving of protein, extra serving of fiber instead of helping yourself with an extra roti, which is maybe more convenient and more tasty. Right. Second thing is engaging in regular physical activity to improve insulin sensitivity and blood sugar levels. Now, every body reacts different to different kind of activity. One, few people react very well. A few women might react very well for yoga. Few women's body might react very well for weight training, and few women's body will react very well for cardio. Now, in this case, what you can do is you can start utilizing or you can start doing some kind of an activity and judge by yourself or understand by yourself that what is actually suiting you. Note your weight before you start your activity. Note your weight every say alternate day or every third day or every once a week, depending on how much you can handle checking your weight. And then see what are the differences you see in your weight or in your inches. Generally, improving on your health is not only it's not only dependent on the number that you see on the weighing scale, it is also on your inch loss. So maybe check your inches, check your weight, everything is considered overall, and make sure you get your blood work done every, say, 3 months to 6 months, depending on whatever your doctor is asking you to do. The other thing which also comes under workout or which also comes under mindfulness is do some kind of stress reducing techniques like your meditation, your breathing to keep your hormones in check. Apart from this, one more thing, stress reduction, what you can do is indulge into the hobbies that you like. Everyone has different type of hobbies, unless the hobby is eating food. That's a separate question. But involve into hobbies which you like. Maybe you're sewing, reading books, listening to music, watching movies, etc. Involve yourself in a 30 minutes to a 40-minute hobby on a daily basis if you feel meditation or deep breathing is not your thing. But always give first preference to meditation and deep breathing because that is something which is healing your system from within. Another very important thing is taking prescribed medications continuously and monitoring your blood sugar levels also regularly. I always tell this to everybody, do not be your own doctor. If you know you have a medical condition, please reach out to a professional, take a proper help, make sure you're taking the medications in the way the professional has recommended, and be very regular in monitoring and follow up with your professional as well because they are someone who can guide you in the best way. Okay, now this was about what you can do with basic, diabetes and women health. The other thing, what we commonly see is PCOS and diabetes. PCOS is polycystic ovarian syndrome. It is often associated with insulin resistance. Now, remember what I told about insulin resistance. It, it interferes with your glucose metabolism. Your insulin is not utilized in the right way. Um, as it's mentioned over here, where the body cells do not respond effectively to insulin. Now, this can, of course, lead to high blood sugar levels and making it is going to make your body, it's going to make more difficult for your body to lose some weight. It is also going to make difficult for your body to manage the blood sugar level and also lead to diabetes in the future. Just in case, if you have only PCOS and no diabetes, make sure you're following a very systematic regime to improve your body's insulin sensitivity so that it does not lead to diabetes in future. Okay, now what you can do in this case? More or less, it's the similar thing that you have to follow when you have diabetes with, normally. You have to focus on low GI food. Low GI food means low glycemic food. To put you into simple terms, make sure you have foods which are high on fiber. Okay, portion control is extremely important and your regular meals. Do not starve yourself. Do not think that if I will not eat, I will lose weight, I will feel better. No, do not starve yourself. Okay, make sure, like I said, make sure the food is rich in fiber. Follow meal sequencing. One thing is which is not mentioned here is follow meal sequencing for better health. Where when you start your meal, make sure you have your fibers first, which means that you have your vegetables or your soup first then proceed towards the protein of the meal, maybe your non-vegetarian food or your dals, your pulses, your sprouts, and then proceed towards having your carbohydrates. Choose millets over the other grains, which is, very good even for your hormonal balance, and they're high on fiber, and most of the millets are also high on iron. Other thing is strive gradually, and for sustainable weight loss one what I can say, one hindrance that you get when you have to tackle PCOD is your weight. It becomes very difficult for you to lose weight. Do not go on any kind of crash diet or do not do anything which is non-sustainable. You might be hearing to go ahead and go for a keto diet, go for a paleo diet, go for 2 meals, a day diet, etc. Do not do that if that is not sustainable. Better manage your portion sizes, follow meal sequencing, okay, and eat mindfully. If at that very time, if you feel hungry, but you've just had a meal half an hour before, think why are you hungry? Probably your body needs water. Probably your body needs a little sleep. Right. So maybe approach that first than approaching your food. Apart from that, like I said initially, also do not mix your emotions or your happiness through food. If you're happy, eat. If you're sad, eat. Do not do that. Our body is like a car. You have to fuel it. If it's an 8-liter tanker, it's an 8-liter tank in a car, you have to put fuel only for 8 liters. Likewise, your body has a specific capacity of eating food. Make sure you're having only that much and not overeating, because that extra portion only is something which is going to increase your insulin resistance, increase your sugar levels, and increase your weight. Right. Apart from this, of course, practice meditation, practice deep breathing, yoga, any kind of stress relieving activity, which you're, of course, interested in. The other is engage in low intensity exercises, okay, and combine both strength training and workout and aerobic exercise. So in this, what you can do is you can manage your sugar levels in a way and understand your own body, okay, which will help you improve your body's strength, your body's health. Okay. Things to keep in mind before conception. Of course, every lady does have this one phase when they have planning pregnancy. Here, you can consult a specialist, schedule a preconception appointment with a healthcare provider experienced in PCOD and diabetes to create personalized plans for you. Okay. Um, so you can do that. Firstly, speak to your doctor. There's no harm in talking to your doctor, of course. Just go to the doctor, plan, speak to them what exactly is needed. Consider taking, prenatal supplements like folic acid, zinc, vitamin D. All of these are minor supplements which are necessary if you have to improve your, body from within. So these supplements, if they give supplements, I've actually seen a lot of ladies, if the supplements are given, they might not just end up taking supplements. They would say, why would I take supplements? I will get it from food. But food has a specific limit to when it can give you those nutrition. Additionally, if you're lacking in those nutrients, you will have to take certain supplements because supplements are given as an add-on to improve your health even more. Right. Other is work with your healthcare provider to address hormonal imbalance um, that affect your fertility. It is not compulsory that every PCOS lady is infertile. If at all there is something which is, hampering or something which is coming in between your fertility or coming in between your pregnancy, speak out to your healthcare provider openly. They will give you solutions for the same. And keep a track of your menstrual cycle, your ovulation, and seek support from a healthcare professional or any support group. Nowadays, you have a lot of apps where you can actually keep a track of your menstrual cycle and your ovulation, everything. So I personally find it more easier to do that. Maybe you can also opt for the same. Oh, another thing here is menopause. Menopause is something which is, like a nightmare to most of women around. So menopause, of course, we know leads to weight gain. We know leads to a lot of hormonal issues. We know leads to a lot of deficiencies. This is basically characterized by a decline in estrogen level, which means reduction in estrogen level that can lead to changes in insulin sensitivity, which means that can lead to decrease in insulin sensitivity, which results in your sugar fluctuations, your challenges with diabetes management, losing weight, everything. So, they always say whenever you go to a gynecologist or a healthcare professional and you're about to hit menopause, they would say menopause स्टार्ट हो उसके पहले आप आपका वेट लॉस कर लो उसके पहले आप आपका ये मेडिकल कंडीशन ठीक कर लो right? Because even they know after menopause, it is a little difficult to, to achieve those things and to achieve your health goals because your hormonal levels are pretty less at that time. Okay. The changes in menopause, of course, weight gain, what I already mentioned, we experience a lot of weight gain during menopause, which can worsen your insulin resistance. Second, hot flushes. Hot flushes are sometimes that you're sitting and you suddenly start, sweating profusely, or you feel that it's hot for no reason. All of these are hot flushes, which is also a symptom of hypoglycemia. It is mistakenly termed as hypoglycemia. At that very time, do not, do not by yourself understand that it is hypoglycemia without checking your blood sugar level. It can be hot flushes. The only thing that you have to do is maybe sit in a place where you get proper amount of air, open your windows, sit in a very well ventilated place, and you will be fine. Drink a good glass full of water, the hot flushes will set. Okay. Other thing is your bone health. Most of the times we see that osteoporosis, osteoarthritis, all of these seep in post menopause or during the menopause because your body's calcium level goes down. That's the time when the doctors and the professionals are going to give you calcium tablets, calcium medicines, calcium drops, injections, etc. So maintaining your bone health during menopausal phase is also important. This will put you at a high risk at osteoporosis if you do not keep your bone health at check. Okay. Other thing is your heart health. Both menopause and diabetes are risk factors for heart disease. Women going through menopause with diabetes need to pay extra attention on heart health, including blood pressure and cholesterol management. Of course, if your hormones are changing, if the hormones are fluctuating, your glucose metabolism, your fat metabolism, all of your metabolism are fluctuating. All of your metabolism are getting, what you can say, challenged. That's the time where your heart also is getting challenged, right? So you have to make sure that as soon as you hit your menopause or are about to hit your menopause, make sure you're getting yourself tested very regularly as per what the professional advises you, and do not take your health for granted. Okay, now here, what can be done? Regularly monitoring yourself. Like I said, you have to monitor yourself very regularly. Blood sugars are pretty easy to monitor, where you can do it at home on glucometer. And make sure that every 3 months you're getting your HbA1c, your fasting sugars, your post-meal sugars tested. Now, if this is done, you know where you are standing, at least with diabetes. Second is the hormone therapy consideration. Discuss with your professional the impact of hormone replacement therapy. Hormone replacement therapy is basically supplementing hormones, additional hormones, which your body has lost during the menopausal phase, which will definitely help in improving your body's insulin sensitivity, improving your insulin sensitivity, and considering considerably managing your blood sugar level. Weight management. Again, in this phase, also, I would highly recommend to not go any crash anywhere in any kind of a crash diet or anything starving yourself, because while hitting the menopause, your body is already losing a lot of nutrients, a lot of minerals. While getting into crash diets, the body will lose all the more minerals and make you look weak. I'm sure that when you want to lose weight, you would not want people to tell you that are you suffering from any illness? Are you ill? Why have you lost so much weight? In fact, I want people to tell that, oh, you've lost weight, you're looking very pretty. If you go on a crash diet, this is what happens. Your face, your other things also get affected. Not only your hormones, or not only your vitamins and minerals, because if the vitamins and minerals come down, automatically it is going to show up on your face, it is going to show up in your body, right? Other is stress reduction. This one point was again constant in every phase that I say. Make sure you practice some kind of stress reduction techniques. Either go into your hobbies, or do mindfulness, or do your meditation, your deep breathing exercises. If you do not know how to go ahead and do meditation and deep breathing exercise, seek professional help. Do a guided meditation. That's also fine. But doing is what is important, right? Um, Pay attention on your heart health, on your cardiovascular health. Okay, make sure along with your HbA1c and fasting sugars, you are also checking your cholesterol levels, which is the lipid profile, very regularly. If the lipid profiles are in check, I'm sure your heart health also is in check. So you are someone who can take charge of your own health. Apart from this, we also see a lot of mental health challenges that a women face with diabetes, right? Because they are a lot of there are a lot of fluctuations in the hormone that happen very frequently. These mental health challenges do involve depression and anxiety due to any kind of emotional burden in managing everything together. We are talking here about diabetes and PCOS and hormone management, but I'm sure every woman does have to manage a lot of more things apart from their own body as well, right? So they do face these mental health challenges. Now, here what can be done? Okay, one hormonal, here what happens is your hormonal impact, your hormones changes during the menstrual cycle, pregnancy, menopause, which affect both your blood sugars and your mental health. Psychosocial stressors. Managing diabetes involves coping with stressors like fear of complications. These stressors may impact mental well-being. There's a separate stress also when you have diabetes, is what we can say social and peer stress also, which goes about, when you go out with friends or when you go out with family, you have this constant stress that I cannot eat this, I cannot eat this, I cannot eat this. If I eat this, my sugars will go high. If I do this, my sugars will go high. Follow very simple steps, like I said, of meal sequencing, even when you're eating out. I am sure your sugar levels will be in check. Stigma reduction, reducing the stigma associated with diabetes and mental health issue is vital. Any kind of, I see a lot of people with a lot of denial, like a lot of women having this denial saying that, okay, no, I am not in depression, I am not, I don't have anxiety, I don't have this, because they feel that if this comes out, they might be treated separately. That's not the case. If you reduce that issue, make sure how we can take you out of those mental issues, take help of the family, take help of the professional, work on your own self. Apart from that, self-care also, improves your mental health. Engaging self-care practices such as mindfulness, meditation, and relaxation exercise can help women with diabetes management, stress, and improve mental well-being. Other things also that has to be considered apart from all of this, is your meal time. This is very necessary. Most of the times we see in women that they do not consider their meal timings. They will say that, okay, let the family eat first, I will eat last, or maybe I've eaten breakfast late, I might eat lunch late. Why would you want to do that? Keep your also health as an equal priority as your family's health. Right. Other thing is mindful eating. Practice mindful eating by savoring each bite, paying attention to hunger cues, and avoiding emotional and stress-related eating. This is what I've been saying since the first, right? Make sure that you're following meal sequencing. Make sure you're sitting peacefully, focusing on your food, chewing each and every bite, relishing the flavor, and eating the food. And do not involve in two things. One is visual hunger, and the other is stress-related hunger. I'm sure everyone must be knowing visual hunger. When our free times, what we do is we would just take our phone, we would just scroll in the phone, and most of the times what we see is your food videos, your food images, etc., coming there. And looking at that constantly, you probably feel like eating, but you're not actually hungry. So avoiding both visual hunger as well as stress related eating. Okay. Sleep optimization. Make sure you're sleeping very well. If you sleep very well, automatically your body is resting very well. If your body is resting very well, your hormones are in place. Your next day is, has good energy levels. Here, it's not only about the quality of sleep. It's also about how many hours do you sleep. Make sure you clock at least 6.5 to 7 hours of sleep on a daily basis, right? Controlling your craving. Now, most of the times we get this sugary craving. Manage your cravings and opt out or reach out to healthier versions of sugar cravings. Or make sure if you feel that I don't need that at that time, just avoid. Right? There is a very thin line between my body needs it and my mind needs it. So, if I'm willing to eat it, I want to eat it, or I need it. So if you actually need it because you're hungry, that's a different thing. If you feel like eating it, that's a different thing. Right. So take, you can maybe have two differentiated things and make sure that you focus on what actually is important. Other is hydration strategy. Make sure you are having good amount of water. If you feel that you're not able to drink water, eat your water. Maybe in the form of watery vegetables, in the form of watery fruits like cucumber, watermelon, celery, your bottle gourd. your lauki, all of these are high on water content also. So make sure you're eating your fruits and eating your vegetables if you are not able to drink as much water. I would also suggest you can always keep a bottle full of infused water with you whenever you want to drink water, because sometimes that flavor water would actually help you drink more water, and that's an added benefit because it's infused water, so it has a lot of vitamins, it has a lot of minerals in it. So infused water is something which will be helpful um, to make sure that you increase the water intake. Okay, so as I can see, there are a lot of questions that have come in.
Yes, Bhakti, there are a couple of questions. I'll just go ahead and read them out to you. Right. So the first one is they're asking, can I take a nap after my lunch?
Um, Absolutely, you can take a nap after your lunch, but make sure it is after 1.5 to 2 hours of your lunch, because gravity works everywhere. It takes some time for your body to reach the food. For example, if this is your mouth, this is your esophagus, and this is your stomach. It takes some time for your body to get that food from the mouth till esophagus and stomach. If you sleep, that time gap is going to increase because your gravity is not working there. Besides, sleeping immediately after a meal may lead to refluxes also. So make sure that you are keeping at least 1.5 to 2 hours gap after your lunch to go off.
Got it. Thank you, Bhakti. So there are a couple of other questions. This is by Mr. Shivakumar. So he's saying that he's suffering some sort of like diabetic neuropathy or like paralysis, and he has some nervous weakness, and he's also stressed about it. So do you have any suggestion for him or anything you would like to say?
So diabetic neuropathy, of course, is happens when your sugar levels are at a very high level. That's because your anterior, your posterior nerves becomes very sensitive to anything. I would really recommend two things. I would recommend first do some kind of stretches, yoga activity, and breathing, so that those nerves are activated, and so that your nerves are activated, and you don't really the pain reduces accordingly. Find the trigger which actually reduces your pain. So I'll give you one example. One of my user had the same kind of a diabetic neuropathy which you're saying, had nervous weakness, had sort of paralysis and not able to walk much or something. He found his trigger which was reducing his neuropathy by actually sitting in vajrasan position post every meal. What Vajrasan position actually did it actually dropped his sugar levels post meal because your soleus muscles are activated. Because of that, his neuropathy slowly and steadily started reducing. Getting down your sugars to below 150 is mandatory when you have to reduce the neuropathy pain. And one more thing, what you can start doing is if you feel that it's too, you're feeling too painful, just take some coconut oil, put some camphor or kapoor, what we use in the mandir, just crush it, warm it a little, and apply it on your legs or the area where it is painful, and massage it in the upward direction for 2 minutes before you go off to sleep. And next day you can just wash it off. That is something which will improve your pump in the blood circulation at that particular level, and the I'm not saying that the pain will reduce immediately, but considerably you will start seeing drop in the pain.
Got it. Thank you, Bhakti. So another question is by Miss Geeta. So she's asking, she's saying that she had diabetes when she was pregnant, and now her HbA1c is around 7. So she's asking, should I go for reversal? Because she had gestational diabetes. Is that considered to be type 2 basically?
It is considered to be type 2 diabetes, right? Because type 1 diabetes is something which you have it by birth. Your body does not make insulin at all. That definitely can consider for reversal when you have gestational diabetes and HbA1c 7. What you have to do is you have to just make sure that you follow exactly what your healthcare professional says, follow mindful eating and meal sequencing. You will be able to reverse diabetes. I will not say within the first 3 or 6 months, but I'm sure it is reversible if you follow the lifestyle modifications which the healthcare professional is going to tell you.
Got it. So I think there's a question where they're asking us to show the first slide on estrogen. But sir, once you like this session would be there on YouTube, right? So if you scroll, if you like slide back backward, you will be able to see all the slides. So you can go ahead and do that. And they also have a another question. They're asking if we can have coconut water.
Now, if you have diabetes, this is a very controversial question. If you have diabetes, coconut water you can have on a very, limited basis or very rarely, say maybe once in a week or say once in 10 days. But if you're having very high sugar levels, I would really recommend to avoid coconut water because coconut water does lead to sugar spike. So it's always advisable to avoid coconut water unless there is no other option.
Got it. Thank you, Bhakti. So another question by Shika ma'am is she's asking what type of fruits can a diabetic patient take, and can a sugar patient take rice once a day daily?
Okay. I think these are very common questions because the first thing what other people would say is don't eat fruits, don't eat rice, don't eat this, don't eat that. Okay. So in terms of fruits, you can have any and every fruits except for the ones which are high on starch, like your fruits like banana, mango, chiku, custard apple. These fruits are high on starch, which has to be avoided. If you have any other fruits, even like melons, even like your apple, make sure you are having in limited quantities by adding some roasted seeds on it so that there's an added fiber to it, which will help in digestion of those natural sugars. I always say even fruits are nature's candy. So it's always advisable to have in limited quantity, even if it is natural sugar. The second question about rice once in a day. If you are a hardcore rice eater, you can have rice once a day, but make sure you're checking your sugar levels post rice to actually understand if that is suiting your sugars or not. When you have rice, you should make sure that your rice. So I'll give you a simple tip to have rice. If you have one katori of rice, have three katoris of vegetables along with that one katori of rice and an additional two katori of source of protein. That will reduce the sugar spike post your meal, but follow meal sequence.
Got it. Thank you, Bhakti. So another question is, they're asking, okay, they are 52 and they have a history of osteoporosis. And so she's asking what kind of things can I do to, reduce this?
Reduce osteoporosis.
Yes.
Firstly, get a bone density check done to see what is deficient in the body, to understand how severe is osteoporosis. Make sure you are consuming good amounts of calcium, either in the form of supplements or in food. Most of the times in food, milk is one of the things which you can consume, milk, buttermilk, curd to give you calcium. You can start including white sesame seeds in most of the foods that you eat. That will also help you with improving osteoporosis. Make sure you reduce some weight in the healthy form so that you don't get any more deficiencies because having osteoporosis and 52, which means of course menopause, already you are in that deficient zone. So get your blood work done, check what is deficient and start with the deficiency makeup.
Got it. Thank you, Bhakti. So there's another question by Mr. Raja. So he's telling, does taking brown rice reduce the sugar spikes?
So I'll tell you one thing, guys, that rice is rice. You have brown rice, you have white rice. It is ultimately rice. It is a form of simple sugar. So following with the brown rice along with good amount of vegetables and proteins is something which will help in reducing the sugar spike. It's not going to not spike up the sugar. It will, but considerably lesser. So make sure there is good amount of fiber and protein in the meal when you're having rice. And rice also has to be limited.
Got it. Thank you, Bhakti. So this is another question by Miss Anjali. So she's asking, how do I reduce my sugar and my weight? She is taking 10 mg of daily steroids for high eosinophils.
So in this case, what you can actually start doing is look out for early dinners. Make sure that you're having early dinners. Make sure that you finish your dinner by 7:30. This will help in regulating your hormones throughout the night. because at night 9 p.m. is when the melatonin from the body is released. Now, melatonin is a sleep hormone which deactivates most of the hormones in your body. So it's always advisable to finish your dinner by 9:30. Finish your dinner by 7:30 so that by 9 o'clock, most of your food is digested and we don't need a lot of hormones at that time. Second, do not starve yourself a lot. Make sure you're eating at regular intervals and working out. Check for which workout works better for you. Um, is it weight training? Is it cardio? But do not focus on one workout only. Look for changes constantly. And maybe speak to a healthcare professional or a nutritionist to plan an exact diet for you. Because you are on steroids, certain calculations of nutrients will be needed. So it's always advisable to speak to a nutritionist to plan a personalized diet.
Thank you, Bhakti. So another question, okay, they're asking, what about milk? Can we take a glass of milk daily?
Um, so I'll tell you nowadays, if you have PCOS, if you have any hormonal issues, a lot of them are asking to avoid milk for two reasons. One, it might lead to lactose intolerance if you already have some hormonal things. And nowadays, we know that all the cows, buffaloes, everyone is are being given hormones, to improve the milk production. That is also one reason why we ask to avoid milk. And second, the lactose in the milk, we've seen that it does raise your blood sugar level too much because though being natural or natural sugar, lactose being natural sugar in milk, we are drinking that sugar and not eating the sugar. So your digestion there is incomplete, hence it leads to sugar spikes. So I would suggest avoid having milk, but you can have curd, you can have buttermilk, and you can have paneer. Curd and buttermilk will serve as probiotic and improve your gut health. Paneer is going to give you good amount of calcium and protein. It's always advisable to have milk products rather than milk.
Got it. Thank you, Bhakti. So there's another question. This is on intermittent fasting. So they're asking, would you go over intermittent fasting if I need to gain weight also? Basically like a low carb, high fat diet with intermittent fasting.
So when you have to gain weight, I'm sure you don't want to gain weight in the form of fat. You would want to gain weight in the form of muscles, right? So in this case, a low carb, high fat diet is going to, lead to weight gain in the form of fat and cholesterol. You want to go on intermittent fasting, there's no harm in going on intermittent fasting, but make sure you're fulfilling your daily calorie and protein requirement because that is necessary when you have to gain weight. You have to have approximately 1.3 to 1.4 grams protein per kg body weight to gain weight. And your carbohydrates have to be in moderation and not too much because I'm sure if you're watching this video, you are diabetic as well, or for whom you're asking the question is diabetic. So carbohydrate is something which is going to, shoot up the diabetes also. So a high protein, moderate carb, moderate fat diet is going to work for gaining weight and focus more on weight training if you have to gain weight.
Got it. So another question on intermittent fasting by Ranjita ma'am is she's asking, can I do intermittent fasting? Will it help in diabetes?
Absolutely. So the thing that I told about melatonin works more with diabetes. So as in when there is darkness or as the sun sets, your body's melatonin hormone goes high from 9 o'clock. So intermittent fasting does help in diabetes because by the time the hormones, the melatonin is going up, which means it is shutting your insulin, your food is digested. So automatically, the rhythm is being set. But understand intermittent fasting is meant to eat early dinner and not to adjust the timings by yourself. If you're following intermittent fasting, make sure you're having your dinner by 7:30.
So another question, Bhakti, was they're saying that they're taking insulin 2 times a day, 24 units each time. Is it harmful in the long run?
Insulin is a hormone which is made in the body, so it's not really harmful on the long run. But if you are taking 24 units, 2 times a day, I'm sure your body is also making. You've not been taking since you were born, right? So this is basically something which your type 2 diabetes. So it can be reversed as well. So look out for lifestyle modifications, look out for proper plans, and you will be able to reverse the diabetes also if you are following a healthy lifestyle and maybe reduce our insulin dose also further.
Got it. So we have a couple questions about certain foods, right? So one of them is asking, is ashgod juice recommended for diabetes, and should potatoes be completely avoided?
Ashgod juice is definitely recommended for diabetes. You can have it in the form of juice or you can have it in the form of sabzi. It's just white pumpkin. It's high on water also. So just in case if you're not able to drink as much water, you can boil ashgod and eat your ashgod or drink it with ashgod juice by adding some pudina, ginger, etc. in that and make it more tastier. Potatoes, I wouldn't say you should completely avoid potatoes, but you can have once in 10 days a small potato. So everything in moderation is recommended, not going complete zero zero on everything. Whenever you're having potato, understand potato is carb. So if you are having potato, make sure your that meal has less of roti and less of rice because your that carb portion is compensated in potatoes.
Got it. So another question, Bhakti, was that I find it very difficult to control cravings in the night time, and I eat lots of food. So how can I control these cravings?
Um, Generally, cravings happen for two reasons. One, you're either stressed. Second, your water intake in the entire day is less. In fact, three reasons. Third is your protein intake in the entire day is less. So, firstly, make sure you work on your water uptake. Make sure you're having good 3.5 liters of water in the entire day. This will reduce the cravings. Second, if you're staying up too much till very late, why would you want to do that? Maybe just go to bed at 11:30, and then complete your sleep and rest well so that your hormones are also balanced well. And because you're sleeping, you will not even get the craving. The third thing is manage your protein intake in the entire day so well that you don't get those cravings. Now, protein is something which is slow release and it delays your gastric emptying, because of which you don't feel hungry also for a very long time when you have a protein rich dinner. So, or a protein rich meal basically. So, make sure you're keeping a check of your protein intake. Second, you are having a good amount of water in the entire day. Third, if you're staying up for very long, please go off to bed early so that this is there is this kahavat in Hindi na rahega baas na bajegi baasuri. Same way.
Got it. Thank you so much, Bhakti. So another question is, they're saying that, okay, so this is by Miss Ria. So she's saying that she is a vegetarian, and how much protein does she require? Her body weight is around 52. And like, because she's vegetarian, she's concerned about her, protein intake, and it may be low. So what would be your suggestion for people who are, vegetarians and are looking to incorporate more protein in their diets?
Um, so I'll give you certain things. When you are ideally the protein requirement is 1 gram protein per kg body weight. Okay, being vegetarians, the sources of protein that you can have are your sprouts, your pulses, your tofu, and your paneer. These are the sources of protein, good source of protein, which you can start including in your routine on a daily basis. If you feel eating too much is something which is difficult, make sure you incorporate all of these things in your rotis itself whenever you have, rotis. So what I have lately started recommending to a lot of my people is that when you knead your roti ka dough, make sure you use some softened paneer to knead your roti dough. That is going to give an added protein to your roti. Secondly, you can stuff the separate parathas or roti with your dals and sprouts, so that in your plate you feel it's not too many things that I'm eating. It's all stuffed into one. Anything and everything you eat should have some sort of sprouts or paneer or tofu into it. If you're having poha for vegetable, make sure you're having for breakfast. Make sure you're having vegetable and sprout poha, so an added protein intake over there. If you still feel that it is not, you're not meeting up to or you're not matching your daily requirements, consider going for a supplement. But speak to your healthcare provider before going for any supplement. Maybe a whey supplement or maybe an all plant supplement.
Got it. So just a couple more questions. I'll just quickly go and take them up. So this is again by Miss Shika. She's asking, what is the normal blood sugar level at fasting and after food?
So fasting blood sugars have to be between 80 to 100. And post meal, which is 1.5 hours after your last bite, should be between 100 to 110. If you have diabetes since a really long time, even 100 to 140 is acceptable because your sugar levels have always been in a very high range, and getting down to absolute normal becomes difficult.
Got it. So another question is by Miss Seema. So she's saying eating protein leads to gastric, especially when you don't have a gallbladder. So can you give me some suggestions?
Uh, any kind of gastric issues are always solved with fiber. So do not eat plain protein. Whenever you have a source of protein, have fiber in any form, either in cooked vegetable, in the form of raw vegetable, or in the form of soup, or in the form of vegetable juice, or maybe you can have some seeds along with that. And do not overdo on protein because of gastric issues that you face due to gallbladder. Do not overdo on protein. Anything and everything that you have and does you feel that when you put tadka or when you put tempering into that sabji or anything that you make of protein, you can add hing to it, asafoetida to it, put a pinch of that. And if the meal has actually gone really high on protein and you feel that you will feel gassy, just chew on some fennel seeds and ajwain. That is going to help you, solve your gas. Make sure you drink good water.
Got it. So I think there's one last question. They're asking, how is cheese? Is that considered to be a milk product?
It is considered to be a milk product. Cheese does not lead to a lot of sugar spikes, but a good quality cheese is what you have to have, maybe in the form of cheddar cheese or Parmesan cheese. Again, check your cholesterol levels, check your triglyceride levels before consuming cheese in a big quantity. Once a week, if you have that, that's not a problem. But if you want to have it on a regular basis, check your cholesterol and triglyceride levels because cheese is definitely high on fat. We don't want, if you have to gain weight, but if you're consuming cheese for specific reasons, we don't want other things to go for a top.
Right. Thank you so much, Bhakti. So that was the last of the questions. So I just want to, thank you so much for such a wonderful presentation. And I think for answering all the questions so patiently. And we've also had some great questions. So thank you so much to the audience as well. But that's about it, I guess, for today. Is there anything you would like to, say before we end, Bhakti?
Firstly, I would like to thank for the opportunity, and I believe I've cleared most of the questions. Just few takeaway points that make sure you are not overdoing on food. Make sure you're not linking your food to your emotions. You're having your portion size, and keep monitoring yourself, your health on a regular basis. There is a reason why doctors and health professionals say that you have to get your annual checkup done, or you have to get your half annually checkup done for a reason. They say prevention is better than cure. Let's just prevent things.
Definitely. Thank you so much again, Bhakti. It was such a great session, and I think we learned a lot today. So thank you so much for joining us today, and see all of you, next Friday.
Thank you so much.
Thank you, Bhakti. Hope all of you have a great evening. Take care, everyone.